What is Munchausen Syndrome by Proxy? Munchausen Syndrome by Proxy is a specific mental illness most often linked to child abuse. It affects caregivers, especially caregivers of children. It is also known as factitious disorder imposed on another. Mothers of small children are often affected by this condition. Fathers or other caregivers can have it as well. Someone suffering from MSP will act as though the person under their care is sick. They often falsify medical information. They may lie to medical professionals about the health or condition of the person in their care. They do this to gain sympathy or for attention. Someone who has this disorder may purposefully take action to make their children sick. They knowingly will expose the child to painful or risky medical procedures, even surgeries. They may deliberately create symptoms in a child. They can do this by withholding food, poisoning or suffocating the child, giving the child inappropriate medicines, or withholding prescribed medications. Creating these situations can put the child at extreme risk. Common illnesses or symptoms that caregivers take MSP victims to the doctor are nausea, vomiting, diarrhea, seizures, breathing difficulty, asthma, infections, allergic reactions, fevers of unknown origins, or other illnesses that require immediate emergency care. Those with this condition are not discouraged by the cost of medical treatments. They don't worry about how they will manage the bills. Instead, they believe driving up a large hospital bill reinforces the perception that they are doing everything they can for their child. They think others will see them as even better caretakers, and they are unconsciously doing this. They are not consciously aware of their own condition. It's a very serious psychological illness. What are the symptoms of Munchausen syndrome by proxy? Symptoms that can help identify someone who has this disorder can be hard to spot. There are certain personality traits and backgrounds that seem to be common. Many have suffered mental, physical, or sexual abuse growing up, or they have received love or attention only when they were sick. As adults, people with MSP are very interested in medicine. They often work in the medical field. They can speak expertly about medical conditions. They are typically very cooperative and friendly with healthcare professionals. They will always appear to be completely devoted to the well being of their child. But to fake symptoms of illness in their child, they may do extreme things. These extreme things can include giving the child certain medicines or substances that will make them throw up or have diarrhea, heating up thermometers so it looks like the child has fever, not giving the child enough to eat so it looks like they can't gain weight, adding blood to the child's urine or stools, or making up lab results. The child who has a caregiver with this disorder will have a history of being in and out of hospitals with unusual health symptoms. Many times, their symptoms do not match any single disease. Symptoms usually get worse when they are alone with their caregiver. Symptoms often disappear in the absence of that person. What causes this disorder? Doctors don't know what causes this mental illness. It may be the result of being abused as a child. Some people with this disorder may also have Munchausen syndrome. This is where they fake their own illness to gain attention. How is this disorder diagnosed? The ethical issues involved in this disorder make it hard to diagnose. Accusing a mother, father, or caretaker of intentionally creating symptoms or making a child sick is a serious matter. Medical professionals will look for symptoms and other incriminating evidence before doing so. One way to confirm suspicions of this disorder is to separate the caregiver from the child and see if the child's symptoms improve. Doctors can also evaluate medical records. They can look for patterns that suggest something is off. For example, a child who has been seen for many different illnesses during a short period of time should trigger suspicion. If MSP is suspected, healthcare providers are required to report it. Can this be prevented or avoided? Unfortunately, there is no way to prevent this disorder. The caregiver must recognize that their feelings about illness are not normal. In those situations, seeking help could prevent them from harming the child. It is usually up to others to recognize the behavior and stop it before it escalates. If someone believes the child is in danger or a victim of the disorder, one must contact the healthcare professionals or police. Safety of the child is number one priority of treatment. The child should be treated for any medical problems that are having and protected from further abuse. They may need to be removed from the care of the affected caregiver. Psychological treatment for the child may be necessary as well to help them understand and cope with what has happened to them. Treatment of the caregiver is also involved, but not very straightforward. Many times, this person will deny playing a role even when evidence proves it. They often have blurred of what is true and what is not. Until they are ready to recognize the truth, it will be difficult for them to get better. Psychotherapy is recommended for persons with this disorder. During these counseling sessions, the therapist helps the caregiver identify the feelings that cause their harmful behavior. Over time, the caregiver can learn to change that particular behavior. Thank you so much for listening.